Isadora Thompson, and today I'm going to be demonstrating sterile gloves. Certain things that require sterile gloves: sterile dressing changes, Foley insertion. The big one is dressing changes outside, or if you're setting up like your OB tray with all of your instruments, you might have to put on sterile gloves to manipulate things. So first, make sure you have the appropriate size. Everybody's going to wear a different size. I have a 6.5, and generally I wear size 6. Check your package. You want your package to be intact. You don't want it to be wet or ripped. Most do not actually have an expiration date. Some may have a lot number, but always check to make sure that maybe that brand doesn't have an expiration date. So my package is nice, it's intact, it's not wet or ripped, and I have the right size. I have a clean working surface. It's not wet or soiled. If it was, I would need to clean that off prior to doing this procedure. I washed my hands, and I'm ready to proceed with the procedure. I recommend that if you have long sleeves that you need to pull them up or tuck them in so that they're not in your way, and remove any jewelry. So I'm just going to kind of tuck mine up just a little bit so it's out of the way. So I open the package, and it doesn't really matter how I open that because the inside of this is what needs to be sterile. So I'm going to get rid of that because I don't want that to be in my way. And they come like this. So now I'm going to open this up, and there's a right and a left. And I like to fold this back like this so that piece doesn't flip up and get into your way. Then reach in here and flip this back. Okay, now the inside of this is what's sterile. So I need to come along this, making sure if there's any of my gloves showing that I'm not touching that. And sometimes they stick. And then I like to fold like this, just to make sure that it stays nice and open. Now I have a 1-inch border all the way around my gloves, okay, that is considered not sterile. So I can touch in through here. Now, generally I wouldn't talk over top of this, but I need to for demonstration purposes. So I'm going to glove my dominant hand. So there's two ways to do it. I can, when I pick up, I can reach inside of that glove, and that's okay. There we go. As long as I don't touch the paper when I pick that up. And then I make my hand nice and small. And I pull on my glove. Okay. Now, I take my sterile hand, holding onto my paper, and I put it inside of the glove like that. Okay? So I want my thumb out of the way, either to move it back or to tuck it in. It doesn't matter. And then my glove's like this, but I can take my hand and put it on like that so that they're this. The book says that you need to keep your hands above your waist. And it doesn't say anything specifying above the shoulders. The AORN, which is a surgical committee, they say not to put your hands above the shoulders. They're not as picky about this out on the floor because we're not in a totally sterile environment. My table was also at a working, waist-high working level when I put my gloves on. Things that I cannot do is I cannot touch any of this stuff once I have on sterile gloves because they're sterile. To remove them, I want to pinch right here and remove that off, and then right there, and remove that so that my hands are on the inside portion of the glove, and then I would dispose of them. If they are covered in blood, saturated with body fluids, I would throw them in a biohazard bag. If they were clean and dry, I could throw them in the regular garbage. Once I was done with that, I would clean up my supplies and I would wash my hands.